All right, here's my zipped up bag that I'm gonna have my first aid kit in. And then going into the first aid kit, I have a couple bags here with some of the items that are necessary. I've got 2 pairs of gloves for a total of 4. And these are gonna be your personal protective equipment. So anything to prevent any fluid to skin to skin contact, just protective equipment. Here I have my ACE bandage, and this is going to be to wrap a wound after we've put pressure on it in gauze pads to apply compression and secure it. And then I have my set of tweezers, and this is going to be to remove any splinters or small foreign objects embedded in the skin. We're not going to remove anything big, but just smaller, like superficial items from the skin, some smaller shards of glass, a splinter, whatever that may be. And then I have my 3 safety pins here. And these are going to be to secure any bandages. So the splint that we're going to go through later with the triangle bandage, but just anything that could be secured. And then I put these on my whistle. This is like a boat whistle here, but the whole purpose of the boat whistle is going to be to get attention, draw attention, have someone come help, something like that. And then the last item in this bag, I have 10 to 15 various size band-aids. And these are going to be for small superficial cuts, scrapes, just minor bleeding, to help cover and stop that bleeding. And putting all this back in here, I also have, as an extra credit item, I have frosting, and this is going to be for a diabetic emergency. We're going to put this frosting underneath the tongue of the person, and that is going to be for addressing blood sugar issues. Here I have my large Ziploc bags. I have a total of 4 of these. These are bigger than the snack size, and these are going to be to put any of our used gloves or used masks, any extra gauze pads that might have been used that aren't actually on the wound still, and that's just going to be a way to dispose of those. I also have a sugar-free Gatorade in here, and this is going to serve as an extra credit item, and the primary use of this is going to be dehydration. So in the event someone's dehydrated from from being outside, we're going to use this to supplement electrolytes. And then in this bag, I also have my flashlight, and this is going to be for an event, for low light situations. We could use this as a light source. It does work. And then it could be to attract attention, to wave someone down, or it can also be used to check if pupils are going to dilate in case of a head injury. And then I also have my CPR mask here. We got this in class. It's pretty self-explanatory. This is going to be used for doing CPR so that we're not directly going mouth to mouth with the person. It's that protective barrier that we're allowed to blow into, and we don't have to worry about touching the other person that way. Let's see here. So I also have my pen and paper. This is going to be to write down any important medical history. So when we're going through sample, dots, whatever the case may be, we could write this down and send it with them to the hospital. And we could also write symptoms down or time of applying something. So in the event of a tourniquet, we could write it on this piece of paper. Or better yet, we could use the Sharpie and write it on their forehead, on the bandage. If we decide to do a tourniquet, we could write it directly on there. And the hospital medical staff will know exactly what we're talking about. And then in here, I also have my triangle bandage. And this is going to be used in case of splinting. So say there's a shoulder dislocation. We're going to put something underneath their arm for a little more comfort. We're going to use this triangle bandage to splint it in the position it's found in. And we could secure that with the safety pins or as a binder, or with a binder. Then staying in here, we have an orange bandana, orange cloth. We could tie this on something and use it to wave somebody down as an indicator, signal, whatever the case may be, to try to get somebody else to help or see us. And then in here as well, I have my 2 medical masks, and this is going to be just like the gloves for personal protective equipment to prevent any airborne, any fluids, and just to overall protect ourselves and our victim. And then as an extra credit item, I put in a pair of hook cutters here, and since I love to fish, I fish all the time. We're using big, like 6-7/0 treble hooks on some of our lures, and if those get lodged into your skin, it's not so easy to back them out because of the size of the barbs. So we could just cut the tip of the lure off with the barb on it, and then just back it right out, and then use our gauze and other first aid supplies as necessary. But this is huge, especially when using the musky lures like we are, to remove any lodged hooks. Then in another bag here, I have a little bit more than 5, I'm pretty sure here. Yeah, so I have 5 2-packs of these antiseptic wipes, and these are alcohol wipes, as you can see. And these are going to be to clean skin, non-damaged skin, so clean skin or potentially equipment that we might have to use. Inside this bag, I also have my 10 packages of roller gauze. And this is going to be used for pressure. We're going to directly put this on a wound, keep pressure on it, and it's going to ultimately try to help stop some of the bleeding. And then I also have my 2 packages of roller gauze, which are going to be used to secure some of these gauze pads. These are the 3-inch versions, but same concept. We're going to use these to secure those gauze pads to the wound. It's going to supplement some pressure and ultimately try to help stop some of the bleeding. And then in here, I also dropped this out of there. Another bag with some of these important items. So this is going to be our low-dose chewable aspirin. And this is going to be used in the event of someone displaying heart attack symptoms. We're going to place this directly under their tongue to hopefully help some of the heart attack symptoms as we call 911. Here is my adhesive tape. And this is going to be used for wrapping gauze to the wounds, securing any bandages, anything we may need to wrap and secure to the person. This will be beneficial. And then in here as well, I have our rain poncho. This is going to be to help stay dry in a situation that it's raining or any other conditions that would make somebody get wet. It's just going to be help either keep us or the victim dry. I actually have 2 of them in here, but those are helpful. And then I also have my space blanket, emergency blanket. It's folded up in here, brand new. But this is going to be used to treat for shock. In the event someone has a condition that we're going to treat for shock. We're going to elevate their feet, put them on the space blanket to reduce any heat loss. I have my trauma shears here, or the my trauma shears. I don't know what they were called on the little checklist, but this is going to be used in the event of cutting any clothing off the person in case we need to do CPR, or it can be used to help makeshift splint, tourniquet. We could cut some cloth with this and then use it to wrap someone. Here I have my 2 instant cold packs, ice packs. You would just shake these up, bend them in half, and then it's going to create an ice pack for you. And this is going to be to reduce any inflammation or swelling. Anytime you'd use ice for the RICE acronym, this is perfect. Have an ice pack on the go that's not necessarily had to been frozen the whole time. Here I have my 2 garbage bags. This is going to be to dispose of any used like biohazards, so anything with blood on it, anything with vomit, saliva, any other bodily fluids, or it could also just be to transport clothes with somebody. So if they have a bloody shirt, hoodie, anything that was on them, we could put them in these bags and send them with them in the event that they're going to the hospital or something like that. I also have my lighter here. and it does work. The lighter is going to be used for starting a fire to help signal somebody down. It could also be used to sterilize any tweezers, any other equipment that we would have and would use on somebody. But there's multi-uses for that. Then here I have my hand sanitizer. Hand sanitizer is going to be used to sanitize our hands in the event that we're not able to physically wash them. It's a good substitute to be able to protect ourselves. And that should be the completion of my first aid kit. Thank you.